When we talk about myeloproliferative neoplasms or MPNs, we are talking about a number of different diseases. It's not one disease, and there is no one test to diagnose MPN. In fact, within the MPN groups, there are diseases that are annotated by specific genetic abnormality. For example, these are eosinophilic diseases identified by activation of platelet-derived growth factor receptors, alpha or beta, that are treated specifically because they're driven by this abnormality with imatinib, for example. There are other similar ones, and here I'd like to mention 8p11 translocation that leads to fibroblast growth factor receptor 1 activation, another genetic abnormality specifically that drives this disease process, for which I'm very happy we have underway a specific inhibitor study, phase 2 study for possible approval in this condition. And on the other hand, we have a group of diseases that are not identified by the presence of specific genetic abnormality, but are identified by common hyperactivity of a JAK-STAT pathway inside the bone marrow cells. Here I'm talking about classic MPNs. This is essential thrombocythemia or ET, polycythemia vera or PV, and myelofibrosis or MF. So these three diseases, ET, PV, myelofibrosis, are uniformly affected by hyperactivity of intracellular signaling pathway, JAK-STAT pathway. And here we have, as you know, development of JAK inhibitors, and ruxolitinib was the first one to be approved for therapy of advanced MF and second-line polycythemia vera. Now, because of a complexity that is present in these diseases beyond the activation of JAK-STAT pathway, we have different diseases that we call them ETPV or myelofibrosis, and we have this different risk of progression from one condition to another, and ultimately to acute myeloid leukemia, which is unfortunate complication in some patients, and is directly related to the clonal evolution and acquisition of different genetic abnormalities and other chromosomal abnormalities, which we are trying to identify for possible targeted therapies in ETPV and myelofibrosis.